Our group is focused on public health disparities in East African independent community pharmacies. Health disparities exist in East African immigrant communities that pharmacists are positioned to both resolve and prevent. However, these small independent pharmacies are not equipped to provide public health services that are needed in the East African communities of the Twin Cities area.
During this presentation, we will highlight the difference in public health services provided by pharmacists of the smallest independent community pharmacies of predominantly East African communities of the Twin Cities with the large national chain pharmacies bordering the University of Minnesota's campus.
First and foremost, pharmacists working in large chain pharmacies are able to educate patients on more products that are shelved outside of the pharmacy. The offering of more over-the-counter medications allows pharmacists working in large chain pharmacies to educate community members on these products to improve their health. In the smaller, independent pharmacies of the East African communities, the selection of over-the-counter medications are far less, negatively impacting the public health of the community by lack of access to more treatment options.
In larger chain pharmacies, pharmacists may provide immunizations and vaccinations that positively impact the health of the community. In smaller independent pharmacies, such as those in East African communities of the Twin Cities, pharmacists typically are unable to provide this service due to cost. This also negatively impacts the overall welfare of the surrounding community as more people may contract preventable illnesses.
Pharmacists in large chain pharmacies have medication dispensing patterns that allow for pharmacists in this workplace to perform cost analysis. This allows these pharmacists to understand population trends, which inherently helps them determine and report the health trends observed in the community so that effective interventions can be implemented. Pharmacists in small individual pharmacies, however, tend to lack the technology, electronic medical records, and therefore cannot analyze the prescription data and pharmacy related information about patients. This disparity is a barrier in providing the health of the community due to the lack of accessible information about the needs of the community itself.
The integration of public health into all pharmacy practice is critical. Pharmacists are in a unique position that allows them to directly contribute to the improvement of the health of the populations they serve. As made evident in this presentation, small independent pharmacies such as the ones found in the East African communities of the Twin Cities area lack the public health services offered by the large chain pharmacies near the University of Minnesota's campus.
The more vulnerable immigrant populations that rely on the small independent pharmacies have less access to a higher quality of care. This is mostly due to the fact that smaller income pharmacies lack the capital to provide more public health services. In order to secure more funding for public health initiatives within all communities, government legislation is needed to support the independently run pharmacies to allow for an expansion of their services to better improve the well-being of their local communities.
By increasing the resource and the logistics of the less financially secure independent pharmacies, the state of Minnesota can advance the equity of care provided to its citizens in a way that promotes the success of underserved communities. Moving forward, as first year students, pharmacists at the University of Minnesota, Twin City campus, it is imperative that we advocate for public health reform as we enter the workforce.